Okay, good evening, everyone. Afternoon, evening, and welcome to the Health and Wellbeing Board. It's the 19th of March. I am Councillor Lucy Steels-Walshaw. I would just like to take this opportunity to welcome Councillor Culloch, who is now on the Health and Wellbeing Board, replacing Councillor Mason. So any apologies for absence? So we have had apologies from Zoe Campbell at Tuve, who is substituted by David Kerr. Tim Forber, we've had apologies from, who is substituted by Fiona Wiley. And from York Hospital, we have had apologies from the board member, Simon Morritt, and unfortunately, there are no subs available either. So that if anyone knows of any other apologies, let me know. No. Okay. Does anyone have any declarations of interest they need to make? Nope. Okay. So the minutes of the meeting held on the 22nd of January, is everybody happy to sign off those minutes, or did anybody want to raise any concerns? Alison?
There's just correction. It was referring to proactive social prescribing. I think it's page 14. It's mentioned as something different from proactive social prescribing, so it just needs to be changed.
Sorry, can you? No, can you say that again?
Right, let me just find the right page.
Did you say it was 14?
I think it was page 14. It just needs to reference proactive social prescribing rather than
practice. I've seen that. Yeah, absolutely.
Okay,
Thank you, Alison. We'll get that changed. Okay, so we'll move on to public speakers then, and we've got one person registered to speak, and that's Ben French from York Green Party on the Healthwatch report on core connectors, who'd like to speak about the need for greater access and visibility of mental health support for young people in York and universal provision in schools. So if you'd like to come forward to the table, Ben, would you like a 30-second warning, or are you happy?
Yes, please. Yeah, give me a 30-second warning.
Okay, no worries. Thank you. Whenever you're ready.
Thank you, Chair. Yeah, Ben French from York Green Party. I want to speak today about the excellent Core Connectors report and their work getting views from young adults in the city. I think it's brilliant. This is run by young people, and I just wanted to speak on this and highlight a few points. But before that, I just want to briefly say first, as a younger person in the city that has struggled with poor mental health, I was lucky. I wouldn't be where I am today without the brilliant counselling and mental health services, both as a child and as an adult, in services like from the charity Mind and from others. But I'm also really aware that I was really lucky. Not everyone has had access to the same services that I've benefited from. And we need a city where everyone, whatever age, background, or income, has access to those same support services that I was lucky with. Speaking to other friends and peers across the last few months and years, and talking about things across the board, it's clear that mental health is the biggest issue for many of us. And that's why I think this needs to be top of the agenda for councillors and city leaders. I think it's really clear that many people know this is so important, but it doesn't always get the wider coverage that it deserves. Many other issues can often come on top of this, but it's really important we bring this to the top of the agenda. I think it's also important that we need more younger voices in this kind of work, and that's really exciting. Why it's really exciting to see the Core Connectors report today. So I want to turn a little bit to just bring out a few points from the Core Connectors report and some of my comments based on it. I want to say a huge thank you to the team behind me and others that have compiled this report, as I think it's so important. And I think for me, this report is an invitation for the council to change the urgency it gives to mental health, to go further and faster in delivering support with the priority that it already has, serving young people's interests. It's so important that all the points on this survey that took really valuable time are actioned upon, and it's really important. So the first one is the really important recommendation at the end of the report for reducing barriers for mental health services in whatever capacity. I think this is really important, but another point that was particularly picked up on by those that were surveyed was the need for mental health support far more in schools. This is currently an area that has been worked on. We know the council has a target for a mental health hub for adults in each area of the city, but for me, there should be a target for a mental health support hub in every school in York. That's the ambition the council needs to have. For me, I would want to ask the council, does the committee have plans to action this, a mental health hub in every school? If not, why not? Additionally, what are funding plans for trans healthcare? The survey picked up really well on this. People don't have the specialist services and sensitive support they need. This goes to the heart of council values: compassion, dignity, and appropriate care. We're not seeing this. Thank you, Chair. I just want to finally say as well, the key thing we need to talk about here is the F word. It's funding. If we don't address that, we're going to continue having problems going forward. And additionally, it'd be great to see people like the core connectors and other young people maybe on this committee in the future driving the decisions that are so often talking about user experience. And it'd be great to see the very voices that use that being the leaders in this area. Thank you.
Thank you, Ben, and thank you for those really important comments. We will consider them when we're looking at the report, and we will address them in discussion afterwards. So at this point, Sean and the two young people who are Grace Robinson and Jamie Lee Jones, if you'd like to come to the table at the front, and they are going to present the Healthwatch York report on core connectors, young people's experiences of health and social care. We've got 30 minutes for this item, and that includes time for the presentation of the report and for questions and discussions. So if you'd like to start whenever you're ready, thank you very much.
Well, I'll kick off, but you're going to be delighted to know I'm not actually going to say very much at all today, which is very unusual when it's one of our reports being presented. But I have to be absolutely clear, this isn't actually a Healthwatch York report. This is our Core Connectors report. I'm delighted with the work they've done. I think just wanted to set up, before I let them tell you all about everything they've been doing, that originally this project started elsewhere. There was an NHS England programme around core connectors, and in Humber and North Yorkshire originally the plan was that would just be in coastal areas. Then NHS England found a little bit more money that allowed a few of us Healthwatch who weren't in the coastal areas to join in. So we inherited the questions and we inherited the aims of the project, what it was going to try and do. So we didn't have as much influence as we normally would around exactly what it was we were going to ask. But us being us, we weren't entirely happy with the questions, and we had a bit of a chat with Peter and the public health team about what else might be quite useful to know. So we added a bit in because we thought you can always get a bit more from the stuff that you're doing. And we were just really keen to make sure we took this opportunity to think about how might we have conversations with young people in the city in the future. So at that point, I'll stop talking about the boring funding bit and the stuff that we were doing and just let you find out what everyone got up to. So Grace, Jamie Lee, over to you.
So a bit of a background. Core Connectors are young people who help Healthwatch York by sharing their experiences and ideas. They're part of the Core 20+5 Connector programme, which aims to reduce health inequalities in their areas. So what we do is we listen to young people's experiences of healthcare and social care. We identify what works and what doesn't, and help raise issues and concerns with decision makers. We share information about helpful services and create reports and presentations based on community research. Help and share digital information and meet other community connectors for peer support. What Healthwatch York managed to do was we recruited 10 core connectors and designed a semi-structured survey that we had interviews with 152 young people across various locations in York. These locations were the Museum Gardens, Ask and Brian College and York College. We visit Nothing About Us Without Us event at Spark in York, and the Over the Rainbow Cafe. We've put in a few questions where we found key themes. Some of them were food insecurity, so people found it difficult to afford nutritious foods and had to sacrifice it. Healthcare access, restricted private healthcare and high cost in prescriptions. Housing and financial strain, so people couldn't manage household expenses. And transportation challenges, so car insurance and increased and so did bus fares, so most young people relied on walking. We also had what impacted young people's mental health and physical health, and most said that healthcare challenges were one of the key themes, such as long waiting lists and poor communication. There was a lack of inclusivity, especially in trans healthcare. Educational pressures, such as exams and balancing workload. They also had concerns about futures with like uni and jobs. Financial strain, so again with uni students, they struggled with rent, and they felt guilty spending money. Some were social and emotional factors, so social isolation and unhealthy relationships. A few said that social media affected their mental health as well.
We also looked at the positive impacts on young people's mental and physical health. So we found that healthcare, there was also positive experiences, and some people did find that they had easy access to it. And in education as well, there were support teams, extracurriculars, so that means that people were socialising as well. So self-care and hobbies, so staying active, spending time in nature and eating nutritious food really helped as well. So social relationships, so like just speaking to their family and friends, and like just seeing people when they were at school as well really helped. So what we think would make York a healthier city is reduce wait times, whether that be in the dentist or like mental health or the hospitals. Increase mental health care options, better access to trans healthcare, more support systems in school, affordable food options, more social spaces that don't include alcohol, so like more green spaces for young people to sit in outside. Affordable food, no, I've done that one, sorry. Better transport, so cheaper prices, more access to rural areas, and buses being more frequent and on time. Yeah, so increased access to outdoor activities and green spaces, especially for young people with disabilities. Referrals from school as well to support services. Improved cycle paths and pedestrian areas, and lighting, especially in the city centre because it's quite dark and dangerous. So we would recommend to introduce a cost of living support, reduce wait times for mental health support, or like offer them something in the meantime while they are waiting, and tackle GP and dental wait times, and create affordable social and community spaces. The transition to adult services, like with the doctors as well, there's like a lack of communication, so just a bit more would be really helpful, and improved public transport.
Okay, so that's everything we want to say, although I did want to say thank you very much for your comments, Ben. It's nice to know that the work is appreciated, not just by us. It's been an absolute joy having Jamie Lee and Grace with us. They've been so easy to work with, so passionate about the work that we've been trying to do. So I hope that shines through the work that you've seen as well.
Thank you very much for that presentation and the report. It's really, really impressive, and I think some of it just changes your views about what people think you want. I think one thing that's really stuck with me is the ask for sober spaces is really innovative, and I think it's not something people expect young people to ask for, but because and so much of our social stuff revolves around alcohol, and I think that reflects a real positive change, and something that we need to listen to people that they want. Really brilliant report. Who would like to start with any questions? Peter?
Thank you, and thank you so much for the for the report and all the work that went into it. There's a lot that goes into doing these things, a lot of time taken and a lot of meetings to get this sort of thing right. So it's so good to see it, and it's got such a wealth of information in that I think we can all reflect on here and try to take the steps that we can. There are some things in this where I'm sure we would all love to click our fingers tomorrow and solve it, and that's really hard to be able to not promise that we can do that this evening, but we can absolutely commit to doing the actions for now that we hope will make the tomorrow better. So thank you so much for what's in here. It really helps. There were 4 things I was going to say in response to it, if that's okay. I've got lots of questions which I probably won't do, because actually sort of sitting there and questioning you probably isn't the most helpful thing. Almost 4 sort of responses in terms of things we're doing. Won't cover all of it. And I used some of your work actually, with Jan's permission, in my annual report, which is being published by full council next week, which is on the health of adolescents in the city, and talks a lot about many of the things that you raise. And there are just a few things I put in there in terms of what we could do. You've talked a bit about mental health and access to mental health services. And until recently, we haven't actually had a group in the city where we bring all the senior leaders together to talk about children and young people's mental health. We've had an all-age mental health partnership, which has been around this table a number of times and is doing fantastic work. But sometimes the children's voice in that has got a little lost. And we're bringing that group together. It's now met once, and it will keep on meeting regularly. And we're looking at 2 things initially in that group. The first is 50 recommendations that Nothing About Us Without Us put to the city and the ICB in general, to look through those recommendations, all made by younger people who've been through often mental health service, to say these are the things we think could change. And we're asking ourselves, how are we doing against all 50 as a city? Because they were produced for the region, but we want to see how York is doing. And the second thing we're doing is looking at that access data, that sort of waiting list data for our particularly children and young people's services at TUV, but it will be also within primary care, how quickly you could see a GP if you feel that's the need, and within school settings. So it's a really early piece of work. Again, I wish I could say it's all solved through that. It isn't, but that's a good starting point. The second thing is we're commencing a piece of work with Alison and York CVS over the next few years, using the Integrated Care Board's resources to do something with the third sector around health inequalities for younger people in the city. There's some resource behind it. I can't tell you exactly what the project will look like because we haven't co-created it with our voluntary sector organisations yet. But it's an investment from the ICB and the council working together into the sector around children and young people's health. So we're really excited to see where that goes. The third thing to say is that one thing Public Health do is every couple of years we survey children at year 4, 6, 8, 10 and 12. So we do a 5-year sample, about 2,000-3,000 children, about their health and well-being, and it gives us a really good long-term trend of how a lot of the things that you sort of recognise in the report are going up and down, and the commitment is to keep on doing that and to keep on highlighting. For instance, this time gambling has come out as an issue that we really need to think about. In-app games and purchases where actually people are being drawn into online gambling in ways that they might have not been able to 10 years ago. Then the last thing is to agree with our chair, and alcohol, I think, needs to be a real focus. And I think we need to get real and bold as a board about the wider determinants of alcohol consumption, which are the companies which make an enormous amount of profit out of advertising, often in spaces which are not delineated between adults and children. So they may be trying to get adults to drink more, but the effect is that children are in those spaces. And I think to try and do as much as we can to make sure that the marketing of alcohol, the pricing of alcohol and the availability of alcohol reflects the actually safeguarding harm around alcohol use with children and young people, and the way that we create sober spaces is a great idea. Zebra striping, where you make sure that you're able to do one soft drink and then one alcoholic drink, a really good no and low alternative menu, nights where there are sober within cafes and sober spaces and sober cafes themselves. So there's lots of things we can do on alcohol. I think we should try and go further on, and it's covered a little bit in our action plan. Thanks, Chair.
Thank you. Councillor Webb.
Thanks, Chair. Jamie Lee, Grace, thanks for that. My name's Bob. I'm a city councillor, so I'm elected, and I have the responsibility for children, young people and education in the city. So apologies, it's probably all my fault, but you know, we're trying to do as good as we can. Okay. I think, you know, there's an awful lot of good in this, and the bit that I think, as Councillor Steels-Wellshaw mentioned, was that there's maybe a bit different and something new, and actually something that as city councillors we can potentially have more of an impact on is on page 19 of the report. You talk about community and infrastructure issues compound these problems. Okay. And then it's affordable healthy food options. And then public transport is overcrowded and expensive. I just wondered if you want to talk a little bit more about, you know, what is it that you're finding that young people are asking for? Just an opportunity really for you to go into a bit more detail about that, if you'd like. And Sian, you can jump in as well. Get everyone started.
I think it's really difficult to answer that with a kind of a coherent, this is what young people think, because, and this won't come as a surprise to you, it depends which young people we were speaking to in which context. So I think, for example, when we were at Askham Bryan College, there was a lot of focus on rurality, and some of those young people were travelling in from different areas, moving around, and were thinking about the challenges they face, not just in getting to college and back, but actually in kind of living your life as a young person about the city. And the sorts of issues we picked up at Askham Bryan felt quite different to the sorts of issues we picked up in Museum Gardens. So it was very situational, but I think there was this general sense that there was a particularly heartbreaking comment about somebody finding that they'd got a sprained ankle, they knew it was going to heal, but they couldn't afford to get their supermarket shopping delivered, even though it was going to add additional strain to their physical injury if they went and fetched the shopping. So they went and fetched the shopping. And I think that's the sort of calculation that some of the young people we were speaking to are making. I cannot afford anything that isn't already in the budget, and it doesn't matter if it does me harm. I have to go and do the thing that I have to do because that's how I survive. So I think there was some really kind of contextual stuff, but there was some richness within that I think it's quite hard to pull out into sort of a general overview of what was being experienced. But I think there was definite indications that young people were feeling challenged by just the everyday living that needs to happen. And I think when we're thinking about transport options for the future, when we're kind of, it's really easy to think that York's a very small city and you can get from one side to the other really simply, but actually depending on where you're trying to get to, what the options are, for some young people that just feels impossible, and the money required to do it is an extra level of complication that they can't engage with. Is that fair, I think, from what you heard? Mm-hmm. Yeah.
Maybe just one more question for me then. I think it's what happens to this next, I suppose, because, you know, if transport's the issue, we've got a combined authority now that's meant to be looking at this and looking specifically at, you know, how children get around, not just York, but North Yorkshire as a whole, right? So I suppose, yeah, this is a great piece of work, and you know, Peter's work, the public health report, is another example. What do we do with this kind of thing next?
I'm very glad you asked that, and I will tell you why. Unfortunately, I know it's not the only bad news we've had about NHS England this week, so I won't dwell on it, but NHS England are not going to provide any further funding for the core connectors work, but we're delighted that there has been a commitment locally to enable us to keep going a bit. So what our ask of people around this table, others in the city who've got views, is what should we do next? We're delighted that Jamie Lee's not with us much longer, but you're here for a bit. But Grace is then here for a bit longer, and we're then going to be talking to York College about whether another T-level student could come in, learn from Grace, take over, and then induct someone else after that. So we want this to be something that we're committed to longer term. And if York College and the T-level students that they've helped us speak with and work with are kind of on board with that too, we have a longer term plan. So I think if transport is something that is interesting and we'd want to understand more about, we can have a think about that. We can shape the questions for what works for us here in York. They still need to be things that our young people want to ask each other, but we'll work on that together. So I think it would be really good to get a sense from people about where do you want this to go next? What would be most helpful for the system, and what could actually deliver some change that young people would welcome for our city? So happy to work with you on that going forward, and anyone else around the board.
Thank you. Thank you. Councillor Cullick.
Thank you, Chair. And thank you so much for all the work that's gone into that. A very simple question, and I probably missed it somewhere, but how were the young people selected? How did it actually come to be that those individuals were interviewed and engaged with this? And what are the parameters of the age group that you were dealing with?
So it's 14 to 25, isn't it? Yeah.
14 to
14
25.
to 25, yeah. So we just asked people around college to start with. And then we broadened it a little bit. So we went to the museum gardens, we went to Ask and Brian, we went to an LGBT cafe in town as well. Where else did we go? What else did we do? Yeah, just a mental health event as well that was in York.
And
So,
it was really interesting that Ask and Brian were very happy for us to go along there. And we've started a conversation with York College now that they're more familiar with the work that we're doing about whether we could have a more regular presence at the college to hear more from the students there, which they're now on board with as well. We also had some conversations about going to voluntary and community sector organisations. So we did a little bit of that, but again, it's something that we'd like to do a bit more of because I think there's some good connections that could be made there.
thank you. So one of the things I was wondering was whether there was, in some of those contexts, I imagine there would have been more young people who had experience of and had engaged with mental health services. But in other contexts, museum gardens, just whoever you got into conversation with. So it was a pretty broad sort of sample of young people across the city, and not just those who've had the experience of mental health support of one kind or another. Would that be a fair assumption?
Yeah.
Yeah. Well, thank you. Thank you.
Thank you. Councillor Runciman.
First, thank you. It's a good report. And what I really like were all the little examples that really made it alive, which is really important. You can have, no human voices in it, but this one did have young people's voices very clearly. I think your 6 recommendations are very important. And my anxiety is that they will disappear. So what I'm asking, and it maybe Sian will answer this, is to have a follow-up. How are we going to follow this up? How can we as a Health and Wellbeing Board know that something's going to be done about those 6 recommendations and have a report back to say what has happened?
Yeah, thanks, Carol. I think it is difficult. The recommendations are quite broad.
Yes.
As Peter said, there's already bits and pieces of work going on in the city that may help to address some of these things, not overnight, but are on the longer term plan of how we keep working to make sure York is a health generating city that works for the next generation. As I've said, there is an opportunity for us to think about what comes next from this. What do we want to keep hearing from young people? And along with all of our other reports, we will be looking to the board members here for responses to every recommendation we've made to pull into a report to go alongside our annual report for the July meeting of the Health and Wellbeing Board. So if there's any feedback from partners around the table about things that they do believe they can take forward from this, we'd be delighted to hear about it. But I think there is a challenge about how we refine some of this down to things that we can practically work on together. And I think that's probably the next phase of the project.
Thank you. Sarah.
Thank you, Chair. So Jamie Lee and Grace, thank you very much for the report. I represent the NHS and the Integrated Care Board, and I really enjoyed reading the report, so thank you. I suppose I was probably reading the report in the mind of probably what Sian has just prompted us to think about, which is how could we sort of start to use this report. So there's a couple of probably reflections I'll focus on around that. I think probably the first thing just to contextualise that with is we know that children's voices are underrepresented, both in terms of the leadership and the way that we're set up to lead and make decisions about services, but also in terms of engagement. So it was really refreshing to read a report around children and young people, and also the NHS Integrated Care Board recently held a sort of public communication pre-engagement exercise, and some of the themes are very similar as well. So trans support, for example, came through really, really strongly. So I suppose I would just give that reassurance that whilst the sample size is small, I think it does reflect some of the wider engagement work that the NHS has done, for example, and again, general practice, mental health, dental, you know, these are absolutely important to all, and I think we sometimes forget that they are. It almost sometimes comes as a surprise that they are of equal importance to our children and young people, but often get left behind in terms of when we talk about access. So thank you for highlighting those issues. I wondered, so that question about the core connectors, where do we go next? I wondered whether or not there are a number of children's boards where actually we might want to engage a conversation around the core connectors. So I think transport is one that we've highlighted. I think that would be really good for our planners, our leaders who talk about how transport is organised and funded, to listen to young people. I think the higher education board as well, in terms of cost of living. I think there's absolutely some things that we can probably do as a system, as a city, and some of our higher education colleges and universities to support with. I was really struck by the affordable and social community spaces, as a number of colleagues have said, and I'm not sure if that's something that we've given due regard to before. And again, there may be where resources are really finite, actually there may be sort of funding sources that maybe we're not pulling on that we maybe could do. So I think we could do some further thinking around that as a board. I also wonder, in terms of the future of core connectors, whether it becomes more of whether or not there's an opportunity to think about the peer support space. So actually, you know, you'll get to find out about how to navigate services just by the fact that you're talking to people and being engaged in these kinds of forums. So maybe the future of core connectors isn't just about engaging with young people, but actually starting to provide sort of peer support networks to young people. Because again, one of the things that came across was not all young people know how to access free, low-cost healthcare solutions, self-care, know how to book GP appointments, and sort of navigate the system. That takes a bit of time to kind of get used to. So maybe that's an area that where core connectors could develop into in the future. Thank you.
Thank you. Martin.
Thank you, Chair. So I'm Martin Kelly. I'm the Director of Children's Services, and therefore, like Bob, can probably take some responsibility, I guess, in terms of things that aren't necessarily working. Although I won't take all responsibility for things that aren't working necessarily in health. I think that's probably a much wider discussion nationally. I think that I do wonder, and I think there's something that is fairly consistent that I see in York of we maybe don't connect well, and we don't necessarily understand what is available. So I think some of the things that you've talked through, I'm thinking actually in terms of transport, we have a significantly discounted transport for young people up to the age of 18, with £1 for any journey across all of the bus network. So not sure whether young people were aware of that. So there's something about awareness raising for me about what is available. There's something for me about what you've got wellbeing in schools. There's a significant amount of investment that's gone into mental health in schools. Whether that gets across to all schools, I think is some work for us to think about. In terms of I think a colleague mentioned York Mind earlier on. We put investments into counselling across York Mind. So again, but do young people know sufficiently enough about it? We just put some significant investment into youth strategy, which brings all the youth services together. And I guess what you've talked about in terms of making sure that young people have access to the right activities and things that are happening in York. York is a wonderful city of things that are happening. But again, do people know about all of those things? And I think what we've learned from the development of family hubs in the city is certainly the adults don't know everything that's happening in the city. And we've had to pull together some of those resources in one place. I think that may be something that we need to do for young people as well. Because I think there's lots of things that many young people just maybe don't know about. And then I think there's something that will contribute to this space, which is York is committed to becoming a trauma-informed city. There's a lot of work happening in the background. Again, a lot of investment from the ICB about making sure that we know that there's 17,000 people that work with young people in York. That's a huge amount of adults that come across young people, given the fact there's about 34,000 children and young people in the city. We want to make sure that every person that has a connection with a young person, whether it's a teacher, a GP or anybody else, are really well informed and trained in trauma-informed approaches, which means that they aren't necessarily just thinking about mental health and well-being, but they're thinking about the whole person and the whole family. And the way that they treat young people in terms of when they connect, they will do that better than perhaps they are doing now. So lots of things in place. I think we need to think about how we get some of that information out to young people across the city, particularly those young people that are maybe transient students coming in and out of the city, which I think we're probably less good at. And then I think there's something about, in terms of the future and the work, I'm really interested as Director of Children's Services at thinking about how do we also find the things that really are working and how do we build those things that we know that work, which I think you've touched on in the report, but perhaps for me there could have been a bit more of in terms of, I see lots of stuff that's coming through a survey that we do once every 2 years, I think it is, across all schools. Lots of really positive stuff in there. How do we pull that stuff out so we can build on things that absolutely do work for young people as well? Loads in there. Thank you.
Thank you, Martin. Alison. Oh, no worries.
My fault. Thank you very much. I'm Alison, Chief Executive at CDS. You might have seen me flitting around at CDS when you're in there. A couple of comments. So it is a really broad set of asks, lots of issues for you. So I think what would be useful is to sort of try and break that down to some specific actions to sort of help focus us. And I think there's lots of things happening that we could link into. So the cost of living, you could feed into the anti-poverty strategy work that's happening. So link up with Sam Blythe, who's developing that at the minute, would be really useful. I think that's in those now. Number 4, I think the creative and affordable outdoor spaces, again, we could perhaps have a conversation with TCV, conservation volunteers, see if they've got anything. Probably the council, you do parks and stuff, don't you? So that might be something we could have a look at. Public transport, I would suggest a meeting with the mayor and have a conversation with him about your desires. I'm sure he'd be open to that, wouldn't he? So I think that will be what I would suggest. So I think it's linking in as far as possible, and would like to hear your voices around the health inequalities funding as well, Peter. I'm sure you've already thought of that, but feeding into that. So there's lots going on. So to try and embed your voices, the easiest way is to get involved with what's already happening to try and influence as a starting point, but also come up with your own actions as well as to what you really want, because it's a lot to sort of try and get your teeth into. So that's what I'd suggest.
Thank you, Alison. Councillor Webb, did you have one more comment? And then I'll start to wrap up unless anyone else.
Yeah, it was just very quick, just to say, Mayor David Skaith, who's York North. So we actually met with care leavers, so young people in both care in York and in North Yorkshire on Saturday. And it was very much focused around transport, because there's young people who live in York but go to Scarborough College, for example, or vice versa. And so what you said, Martin, about the £1 bus fare, for example, is within the city. And so there was that how do we get that to go across? So that's very much live in what he's thinking about at the moment. So yeah, but I agree. The more people who tell that to him on a regular basis, the more likelihood there is of actually something coming from it. So yeah, but that's certainly something to think about.
Thank you, Councillor Webb. Did anybody else want to add anything? No. Yeah, Sean?
I've just been thinking about Martin's comment about the challenge we have in York with people not knowing what's already there.
Yes,
And
yes.
I wondered if anyone else was going to raise the spectre of our previous young people's survival guide.
I was absolutely
Were
going
you
to
there?
mention
Were you
that
there
as
with
well.
me? Because that used to be
It was
every
brilliant.
time it came out, we were like, "Oh, there's a new one. What's in it this time?" And it was such a helpful publication. Very small, very compact in terms of accessible information. I would have written it bigger, but we didn't have the funding, and I understood that. But it was that thing of everything that is happening in York in one place that you can pick up and take around with you.
Yeah.
So I know we used it a lot, and I do think it's a recurring theme in any conversation I have with people about what resources do we have as a city that enables people to help themselves navigate the space. And I know, people talk about online directories, and that's a big thing, but it's not the same as having something you can actually physically pick up in your hand, carry around with you and look at. I know people will say that's what a mobile phone is, but I have found it doesn't work in the same way. A little directory of what's available is a very different thing.
I absolutely agree. And I was also going to mention the survival guide, which was so valuable. And I even remember when it stopped, like we were hiding copies and rationing them just to keep going because we knew that there weren't going to be any more. And I think because a big theme that's come out of this is communication. I think it's really good that we're talking about that stuff is going, and there is funding going into counselling, and there is counselling out there. And I know from experience of working around some of these that there's counselling out there, but not everybody's aware of these counselling services. And I think some sort of central thing, yes, we do have them online, but the other ones were really good. They were also really good in one-to-ones to look at paper copies with people. So I think around communication, that survival guide was absolutely valuable to get the message out there. Yeah, so just to say thank you so much for this, Sian and Grace and Jamie Lee. It's been absolutely brilliant. And to remind everyone that you need to, there's 6 recommendations within this report that need to be responded to in writing because they're going to be collated and presented as part of the Healthwatch annual health and wellbeing report in July 2025. But
sorry, and one last thing, if you're desperate to hear more, there is a session at Priory Street on Tuesday morning, 10 till 12. I know it clashes with another children and young people's meeting, which is unfortunate, but everyone is welcome to join us, so please do if you can. And Jamie Lee and Grace will be there as soon as they can, as soon as their exam finishes.
Oh, wow. Good luck. Good luck and thank you. Thank you very much. Okay. So now we will move on to agenda item number 6, which is the Joint Local Health and Wellbeing Strategy Action Plan. Peter Roderick is going to present this report, and we have 30 minutes for this item, and that includes presentation, question and discussion. Thank you, Peter.
Thanks very much, Chair. So just to locate us and where we are with this, then people may have heard me sort of narrate this a little bit before, but we have a 10-year health and wellbeing strategy. It was delivered and developed now 2 years ago, a little over 2 years ago, with lots of partners, lots of residents feeding in to the strategy. It aligns with our economic and our climate change strategy. It's a bit of a suite of 3 things that the city is working on together. And that strategy, obviously, as a lot of health and wellbeing strategies is fairly high level, although within it, I think following feedback from a lot of people, and certainly sort of my view on it was that if you write a strategy that you can't measure some outputs of it and understand whether you've achieved it, it's not really worth the paper it's written on. So we did actually in that strategy try to make some specific commitments for where we wanted to be as a city. The overarching commitment that we made was that the single thing that probably tells us whether we're having an impact on the health and well-being of residents over a long time period is the gap in healthy life expectancy. So there's three things there: life expectancy, the number of years that someone can expect to live. Healthy life expectancy is better than life expectancy, because generally most people will tell us that though they'd like to live a lot of years, that actual real wish is to live as many years as possible in good health. And then the gap in healthy life expectancy, because what we have been quite good at doing as industrialized societies is increasing both life expectancy and healthy life expectancy. But what we have seen, and particularly over the last 20 or 30 years, is a widening in that healthy life expectancy between the richest and poorest communities, although that gap could be measured in other ways that are not just about income or deprivation, and could be between different community groups. So it's not only solely on a deprivation measure, but that is the most measurable thing. And for instance, when it comes to life expectancy, we know that in York we do have a well-reported 11 or 12-year gap between wards in terms of the number of years someone can expect to live, and healthy life expectancy, we know that's there too. So that's our health and wellbeing strategy. We wrote it over 10 years. And when we came to the conversation about what actions we're going to follow from that, we decided that writing 10 years worth of actions actually would be a bit of a hostage to fortune about what happens over 10 years. Lots of changes can happen. Pandemics can occur, for instance. So rather than do 10 years, we decided to do an action plan which lasted for 2 years each time. We did that. We've been through a cycle for those first 2 years, and back in the January meeting, I brought a proposal for how we were to do it again. The board's view at that point was that our approach had been broadly helpful in writing a 2-year action plan. We probably felt that enough had been done on the first set of actions that we wanted to introduce new work, but there were some that actually probably weren't complete and we still valued. So we were given the remit, Tracy and I, working with colleagues around the table and others within your teams, to go and refresh the action plan, looking at whether actions could be rolled over and needed to be continued, and whether there were new ones. I'd say predominantly we've got mainly new, with a smattering of sort of rolling over actions within what's presented to you in the paper. So what you've got at Annex A is each of the areas with a set of plans. To go through them really swiftly, goal number 1 never had any actions associated with it, because it was that overarching goal around healthy life expectancy, and all the actions we do lead up to that goal. Goal number 2 was about population level mental health. There are 2 bits in this, which were 3 really, about generalized mental health and well-being. There's a goal on suicide and self-harm. There's a goal on loneliness and social isolation, but there is at the start this goal on our general levels of mental well-being in the city. And some actions have been developed, some of them in conjunction with the 2 chairs of the mental health partnership, but some of them coming from a public health perspective, about 5 ways to well-being and programs around improving the overall mental well-being of the city through campaigns about mental health and stigma, and about the 5 ways to well-being intervention. The second is around bringing smoking rates down below 5%. People know my passion for this. Smoking is still the biggest preventable killer. Cigarettes kill 2 in 3 users, and we're on a really good journey here as a city. We are, at the moment, the city with the highest quit rates in the country in terms of our smoking cessation services. And we've seen prevalence decline from when I started in my role as consultant in public health. We were around about 12% in the city. We're now down to just over 8%. So a real knock on the prevalence figures. That's thousands of smokers no longer smoking, which is brilliant. But we still need to go further. 8% is still around about 14,000 people. So it's still a lot in the city who are smoking. So we've got some, I hope, really focused actions. And I would draw attention to the fact that one area I do feel we need to go further on is our smoking cessation offer within York Hospital, and we're working actively with the Trust on that, particularly in hospital and maternity services. And so we are in active communication with the hospital about that and have been supporting them for a number of years. It's a very difficult thing to do in a very busy hospital where there's a huge amount of pressure on beds. However, integrating smoking cessation pathways in there has been shown through the evidence to save bed time, to save bed days, to reduce emissions and to facilitate discharge. So that's something I would highlight just on action 3. Action 4 is about alcohol. We've moved on some of these actions. We've retained an action about brief interventions, and we think around 20 different staff groups per quarter from public health around brief interventions. We want to increase that because brief interventions work really well in having those conversations about alcohol. Again, there's an action here about the hospital establishing its drug and alcohol program, and again some really good benefits there, particularly actually on facilitating discharge from the hospital, because getting community treatment for alcohol is often a real barrier to get people out who are otherwise fit to leave hospital. And then there is a wider action about actually some of the things I've already talked about, the advertising, the affordability and the availability of alcohol in York and our relationship as a city to alcohol. There's an action about reversing the rise in the number of children and adults living with a healthy weight. The reason we phrased it like that is that our statistics when it comes to weight in the city have gone up and up on a 20 to 30 year time scale by small percentages every year. And that's not a trend that has really differed or gone up or down, and it didn't really get hugely affected by COVID. It just seems a little bit of an inexorable rise. And I think the board was keen to not put in high aspirations about halving, for instance, that rate, which would just seem, given the historical data, unfeasible. We want to reverse the rise. So we want to see a turn of that curve. I think that's achievable within a 5 to 10 year window, whereas halving our rates, as wonderful as that would be very hard to do with such long-term trends. So that's the reason we talked about reversing the rise in the number. And we've talked there in the actions around moving to what we're calling a compassionate approach to healthy weight within public health. And I'd actually like to bring back to the Health and Wellbeing Board some further work on our compassionate approach, which is moving away from a lot of the way we've talked about weight before. And I think it actually deserves a much fuller conversation than just today. But for instance, talking about sort of weight and stigma and BMI and the way actually we want to move into a more compassionate and supportive way of thinking about healthy weight. Continue to work around the National Child Measurement Programme and continue to start the healthy weight conversation right at the very start with breastfeeding as a real determinative factor, and then into infant health. Please do.
Yes. Are we saying reverse the rise in the number of children and adults not living at a healthy weight?
I made a time.
We might have missed out a not there.
Yeah.
Well, I hope you have, because otherwise, when I read it, I thought, oh, really?
Yes, I think that's living with
Not
with a
living
healthy
with.
weight.
Apologies.
Thanks, Tracy. Always good to keep attention to the details, isn't it? Thank you, Councillor Runciman. It does, absolutely. And then the last bit within that category is the Henry programme and expanding Henry from our 0 to 5s programme, which is really successful and really evidence-based, into the 5 to 19 group. There's an action around supporting and reducing health inequalities in specific groups, and a number of sort of schemes that we've got going on, particularly around primary care and how it can better serve through its long-term condition management programs, those from inclusion health groups, and actions that we've already talked about actually around the voluntary sector and children and young people, and work around poverty. Some really good work going on, and real sort of credit to police colleagues around the table in terms of real-time surveillance of suicide and being able to work closely with the various groups that respond when, sadly, someone takes their own life. particularly in order to protect loved ones who are at increased risk at that stage and in the future. I was at the Suicide Safer group on Monday, really good multi-agency conversation with lots of people around the table talking about how we reduce our suicide rates, which have been going up. So some actions there around training, real-time prevention, and some community action groups, which are delivered by our CVS colleagues. There's some quite clinical stuff in here, which make no apologies for under Action 8, because there's some real things that within cancer, within dementia, diabetes, and high blood pressure, we can really improve some of the early detection and treatment of disease, which has been shown to particularly improve health inequalities, because it's generally those affluent populations that get their blood pressure diagnosed early and then they get all healthy, and it's our less affluent populations that don't benefit from the interventions that healthcare can bring. So that's under Action 8. Action 9 is about sedentary behaviour. It's about physical activity. And there's some work in there around curriculum support in schools and linking schools up with programs like Mode Stars, which is a way of getting children active on the way to school, which we have just recently started, and around planning, and planning being a really good way of being able to get people more active by designing out that motor normativity, that sort of cars as the only answer for getting around the city and getting people travelling actively. And then the last one is actually left slightly blank. And actually, Chair, if that's all right, we'll probably want, if we talk about all of it, that's fantastic. But talking about Action 10 as our discussion would be very helpful. And the suggestion there is that we want to do work on social isolation and loneliness, and had a really fulsome presentation back in November on that topic. We probably were left with a sense that this was the one in our last action plan that had been left very broad. And in that way, whilst lots of good work is happening, can we measure it? Can we know we're making a difference? And are we targeting our limited resources? My suggestion with this to the board is actually that we choose a group within the city who we know suffer from loneliness and socialization more than other groups, and focus just for these 2 years on that group particularly, and come up with some actions. Not that there won't be many groups within the city who do so. You know, we know, for instance, that younger age cohorts are often overlooked when we think about social isolation. New parents are often overlooked. We know that we've got I think the 14th most transient population in the country. So we're a city where people are moving in and moving out a lot for various reasons. So there are lots of areas we could focus. The suggestion actually, though, would be to reflect the needs of both adult and young carers within this section. Carers were recognised as a group that we didn't talk about enough in the original health and wellbeing strategy. And there's very good evidence to show when it comes to an isolation and loneliness perspective, carers really do see real issues there, and there is a real problem, for instance, just in terms of the self-reported isolation figures. What that looks like in terms of actions, we'll need to discuss and debate and come back possibly to the board, but we've deliberately left this one a little bit less full because we wanted to make sure the board had an input into something we weren't entirely sure where it should go. So, Chair, I'll hand back to you for that discussion and conversation.
Thank you, Peter. And thank you for that report, which shows all these new actions to deliver this 10-year strategy. So today we're asked to approve these actions and then receive regular updates on them. But for Goal 10, we're going to have a discussion, but also delegate formulation to the lead officers. So these actions are on page 67. I just wanted to ask you a question as well about the developing it around the isolation and the loneliness. And I think within that, something that I've become increasingly aware of, which probably should have always been aware of, but the isolation and the loneliness affects every single age group. And I think part of my concern when you first said, oh, we'll focus on, an idea was to focus on one group within that. But the carers group that you suggested does probably cover most ages within that. But I just think that that's something to be aware of, that within that group, we're getting several demographics and several ages. Alison, sorry, did you? Oh, sorry.
Thank you.
Yeah.
I'll just move my laptop so you can hear me. So, I mean, before we had some discussion earlier on today, my questions were going to be about where are we focused on in terms of goal 10 and action 10. And I think in the first bit of the paper, it's talking about carers and care users. And then in the table at the end, it seems to be talking about the whole population and all adults. And I think some of the metrics or measures that have been utilised as part of this work previously actually come from the adult social care survey, which is about carers and people with social care needs. So my question was going to be, can we be more focused, and are we talking about universal support for the whole population of people who may be experiencing loneliness, or do we want to think about whether there's some specific groups within that? And I don't know if we have any measures or surveys for the whole population, so I'm not sure whether we would be able to measure impact of some of those universal approaches that effectively. We would have to probably think carefully about how we might do that. So unsurprisingly, since obviously we did have the conversation earlier, I'm fully in support of thinking about how we might support carers, and in particular young carers, in terms of making sure they've got as much social interaction as they might like and need. And my suggestion for how we decide what we do about that is we probably should think about talking to carers and young carers to see what they think and what would be helpful. And I think we do have some established groups that we could go to in the first instance, and we could, utilise a range of methods to ask people their thoughts. I think probably fairly quickly, but I think it would be much more meaningful for anybody that we're thinking about supporting if we could have those conversations, and if we could commit to, rather than trying to do everything for everybody, it would be great to think that we've got some very, very focused, very specific and measurable actions that we could come back in a year's time and say, yes, we've done those things and that has made a difference. So that would mean we need to also think about designing the evaluation and follow-up of those actions. Thank you.
Thank you, Sarah. Alison.
It's exactly what I was going to say, Sarah, anyway, that's okay. I think the challenge for this this goal is it is massive. And that's why we feel we're not making much impact on loneliness, but we know there's lots of work going on in the city for the social prescribers, local area coordinators, and loads of charities and the work that everybody's doing. But it's very difficult to measure anything that we're doing because it's just vast. So absolutely agree that we should focus on one or two areas. And I've been speaking to carers, York Carers Centre today, just to sort of get a view from Sharon as to what she thinks. And the carers strategy is in development, isn't it, at the moment? And one of the objectives, one of the priorities is about improving health and wellbeing. And one of the targets is to reduce isolation and loneliness. So there seems to be quite a good fit there. So I think it would make sense to link up with them and perhaps come up with some specific actions. And I support working specifically with young carers, a group that I think probably need a bit more of a profile. And some of the actions that Sharon suggested about, we need to identify young carers first and foremost, because they're hidden, I think, amongst us, and the schools are not picking them up. Carer champions in schools, or GP surgeries or within organisations, so we can look at carers, signing the Young Carers Covenant. I printed that off specially. So there's quite a few actions I think we could really get our teeth into, make an impact and measure the difference we're making. So I would support young carers specifically, but I don't know, open to wider carers as well. We could have two actions, couldn't we?
Thank you, Alison. Sian.
I wanted to make a few points. I'm going to continue with the theme on carers because I think it is really important. There's always been a challenge around young carers and carer identification, and I think it's a bit of a wicked system blind spot. I think it would be really interesting. I know the hospital aren't here today, but when they're working with a young person through paediatrics, are they actually thinking, has this child got siblings? What's their role? What are they involved in? And I would hazard a guess the answer is not very often. When I'm having conversations with parent carers, they often talk about the impact on the other children in the family, and yet they're not signposted to the Carers Centre for Young Carer Support. They're not connected to other people. So I think that loneliness and isolation for young carers, if schools, when asked, have identified only six young carers in our secondary schools in York, that suggests to me we have a massive system blind spot. And if we're not identifying that when they're in school, if we're not supporting them with the impact of caring in their school time, there's going to be significant knock-on effects for them in terms of how that plays out. So I think that's really important. I think my real concern that underpins it is that for us in the city, carers have always been a cross-cutting theme, but that means it's nobody's real priority. And I think if we're going to make any impact on carers, we have to think about what we're going to do to embed caring in everything we're doing, because we're not there yet. And we have been talking about this for a very long time. So I would like to see some whole workforce thinking around carer identification. I also think there's something to do about the workforce, which is not connected with this item, but I'm just going to chuck it in there while it's in my brain, about understanding micro caring as a potential career choice. I don't think I've seen anything in any of the workforce stuff that's going on at the moment about micro caring. And I think those sorts of flexible opportunities.
Can you explain what micro caring is?
So micro caring is a career where you give your time and energy paid for by families to do small bits of caring on a much less formal, regular basis. So you might have 3 families you work with and you phone them up on a Sunday and you say, how do you need me this week?
Okay.
And that's how you do it. And I don't think we have embraced that, have identified that, have worked on that at all. Like I say, nothing to do with this particular item, but I just want to chuck it in there for thinking about how do we feed that into some of our workforce strategy stuff, about how do we provide more flexible, useful caring support for people who are carers. The other thing that struck me was the dementia diagnosis wicked issue, which it's not the first time we've sat around this table discussing that challenge. And I think we all agree we'd like it to be higher than it is, but we're not there. So are we confident we're going to make an impact on that? I think there's some excellent work going on around primary care diagnoses and the work that Dan Kimberling's been doing, but can we expand that? Can we ramp that up? Can we increase the numbers of people who are getting a diagnosis and getting it coded right in primary care? I really think if we're picking that, I'd like something that makes me feel confident we can actually do it, because it's been there a while now. And then on the alcohol thing, I thought, just to pick up on the conversation we've just had, is there any opportunity to put in something about sober spaces and including outdoor space, particularly for younger people? And I think there's something about our perceptions of drinking levels in younger people versus the reality. I know far more young people who don't drink, don't want to drink, have never drunk, than I do people my own age. And I think we have not caught up with that as a trend. And I think it's an interesting one that we probably haven't given enough thought to. So if we could include something about that in there, that would be quite good for me. And the reverse of the number of children and adults living with a healthy weight, I thought there was something we should be doing as well about tying that into our ambition to be a trauma-informed city. Because I think many of you will remember there were experiments in the US where they took people with unhealthy weight and put them on an Atkins-style diet, but did nothing whatsoever to support them psychologically, and saw a massive increase in mental health issues, self-harm and other activity. So I think there's something for me about us making that connection that if we're a trauma-informed city, if we understand that people are complicated and the reason why they do things is complicated, we need to kind of tie that connection in. And I think you'll be glad to know, I think that was all I wanted to say. So, but I think it's good and I'm happy with it. But I've just got a few challenges.
Thank you, Sian. Okay, Councillor Webb.
Thank you, Chair. It's my political moment of the night. Here we go. Capitalism kills. There we go. That's essentially what we've got here. Is it's poverty, and we talk about all sorts of different kinds of poverty, but in reality, inequality is the source of an awful lot of the problems that we face right here. So if we solve that one, I think a lot of other things would fall in. So you join me on the barricades outside. Okay. I think firstly on the carer thing, I I don't know the details, but I would suspect that the needs of young carers might be very, very different. At least there'll be some crossovers, but I reckon they'll be very different to, you know, adult carers potentially. And then on the schools part and what schools know, I'd maybe question whether, you know, they're finding 6 children or not. You know, I think they probably know a little bit more, but do schools know what a carer looks like, for example, and what actually classifies as a carer? And you know, I think that might be a bit of learning for the education sort of side of things. But then I actually think there's something from the workforce from the other side of it, in the sense of when adult social care are talking to people who need support, when health are talking to people who need support, when you're leaving hospital, you're heading home for something, when housing are talking, you know, council housing are talking to adults who need support, and there's a question about you know, do they ask, well, who's actually providing this care, who's providing this support, and is that a safe and sensible arrangement? So I just think that could be something to look at as well, in terms of how we're communicating with the people who work with other people in the city. Just on the other parts of the report, Henry is possibly one of my favourite acronyms that no one ever explains. So if you could maybe just go in a little bit more detail about what Henry actually is, because I think it's really powerful, it's really positive. Smoking, I mean, I'm really surprised that we're still on 8% as a city, and I think that it's great that we're doing good stuff, but isn't it, you know, I think 2025, it's scary that we're still up there. I think there might be something missing here about the number of young people who are vaping, having never smoked. And you know, I think that is what is that going to lead to? I think there's maybe something to think about. What is that actually going to lead to in the future? The Healthy Schools Award as well, certainly something that has a positive effect on young people's lives and also within school in lots of ways. And I feel, Peter, that there's something there that we could just add in about how that fits really. And then I'd really, really support what people have said about a healthy weight and the stigma attached to that, rather than, I think, the very heavy medicalisation of that at the moment. Because I just don't, I think if we look around the world, it's not working, is it? So I think we need to think carefully about how we treat weight, because, you know, particularly in a multicultural society like Britain, everyone's different, and what's healthy for one person is very much not for someone else, and vice versa. So I think there is a lot that we could do there. But I would really, really support moving away from that sort of medical model. Yeah, so that's my thoughts. Thank you. Okay. Henry, tell me about it.
Health, exercise and nutrition in the really young. It's a family-based program which is about those things, rather than child weight management, which is the model you just talked about there, the medicalised one, which doesn't always work very well, whereas Henry is very well evidenced at working whole family.
Did you have to look it up, or do you just know it? I mean, I'm sorry.
We've been commissioning it for quite a few years, and I'll sit down with you, Bob, and go through it.
No, we've gone through it before, but I just think it's another one of those acronyms we never actually explain a little bit, and it turns up in these things, and we always should. Thank you.
Okay, we've got a few more people. So Councillor Runciman, please.
Okay, for once, I'm going to disagree with Bob before I say what I actually want to say. Yes, I'm allowed, yes. Loneliness is not necessarily linked to poverty. It's a lot of the issues, not just loneliness, are just linked to a person's circumstances. When their other half dies, then all sorts of problems come of not being able to manage money, of loneliness, of course, having nobody to talk to, etc., which I won't go on about. But the two things I want to say are these. My experience and my knowledge of children and young people is that what happens at home is what they think is normal. They don't realise they're carers because it's never been identified as a separate issue. They just go home and look after mum, or they get up to get up dad in the morning. And it is a very difficult thing for schools to identify. They say, who's a carer? And that the children and young people probably won't put their hands up. But the other thing is, I did some work with GRHT a few years ago now about loneliness. And I was interviewing people outside the folk hall, and I talked to one gentleman who was fairly elderly, if I may say so, about whether he felt lonely. And he said something very significant to me. He said, I'm all right when I'm here, but I'm not all right when I go home. So loneliness is, well, it's almost episodic. You know, I'm all right when I'm sitting in the folk hall with people around me, I've got people I can talk to, having a meal and so on. When I go home and I shut the door and I'm on my own, then it's a whole different matter. So loneliness is a hard one. Alison, absolutely right when she said that. And we can't say somebody's lonely all the time, but we can ask people if they feel lonely some of the time. And that is where often the local church or the local library in particular will come into play, because it's somewhere where people are there and people will talk. And that's what that person needs.
Thank you, Councillor Runciman. We've got 3 more people wanting to speak, and then we will wrap this up. So, Martin.
Thank you. So just to say, I fully support the focus on young carers. I think just to answer some of the questions, it's quite timely in the fact that this morning, or for the whole day actually, we've held a safeguarding and education conference with all the designated safeguarding leads across all of the education system in York. So all schools, all multi-academy trusts. And there was a presentation by 6 young carers to all of those individuals. Way to raise awareness, which is what we know that we need to do. But I think the young people, interestingly, who were all extremely eloquent, explain themselves actually why they may not identify themselves as young carers, and nor do they necessarily want to be. So I think we need to be really careful not to assume that it's our right to say that a young carer should be identified as a young carer. We need to talk to young people themselves. But I think there's a time for young people, and there'll be a different time in their life where they feel that's an appropriate time, depending on what's happening within their family. There's certainly talked about loneliness. There's certainly talked about poverty. Poverty is almost inevitable when you're looking after family who, as you know, if you're looking after them, the chances are that they're not going to be going out to work. So I think the focus on young carers is absolutely sensible. I think it's a number of things, including mental health, which we talked about today. But I think in terms of schools identifying it, I think schools are much more aware as a result of this morning's conversations, where young people from the age of 8 to the age of 17 gave an absolutely superb presentation to about 120 individuals in the city.
Thank you. Thank you, Martin. Sarah.
It's just a quick response, Sean, to your question about micro providers and PAs, and I guess it's probably what we might lead to in terms of some of the solutions in terms of support for individuals. But coincidentally, micro providers came to my attention fairly recently because a councillor raised an inquiry. Unfortunately, not with the positive set of queries about and some concerns about a self-employed worker, and what that's prompted is some further conversations about. We think that there has been work in York in the past to develop that market, if you like, but perhaps not as much investment and support into advice for people who might have a direct payment or might be privately funding support from individuals from a sector that is unregulated. And we don't have available, or we haven't had available, perhaps as much advice, support, access to things like, PA registers or micro provider registers where people can, be vetted and get DBS checks and references be checked, and also you know, support for employers or people who are buying support, to make sure that people are meeting the rules around, you know, tax and so on. So we know that this is an area that we need to do more work in. And we've already got a project that some people will be aware of around direct payments that's identified, and we've been doing some engagement and co-production work with a range of people across the city, who also have identified that there's, you know, some questions about the availability of that sort of advice and support. And I guess the connected point is that sometimes when people are isolated, they can also potentially be at more risk of self-neglect, or abuse from others or harm from others. So, you know, there's potential for, you know, us to be able to, I think, prevent some of those risks of harm, or, you know, risks that might arise for individuals in thinking about some of the solutions that we might work through. But it's just to say as well, my team have also identified that there are some good examples of development work around microprovision and the networks that can support people through things like befriending and perhaps lower level support advice. So we are going to be working with some of those other authorities and areas to think about what we can do to develop some systems and support locally as well.
Thank you, Sarah. Alison, did you want to?
Yeah, I just wanted to talk about reducing health inequalities, goal 6. And we've got an action which is action 20, identify and address barriers to accessing health services by people experiencing poverty with the Poverty Truth Commission. So the Poverty Truth Commission is finishing in 2 weeks now. We've done the work, and the outcome of that is a set of standards, which is about how people want to be treated by services, which is with kindness, dignity, respect, be listened to, understood, etc. So if we could just tweak that one to reflect about embedding these standards across the system, that would be really helpful. So it's just a bit misleading to say, yeah, thanks, Peter.
Thank you, Alison. Yes, Peter.
I just wanted, just in terms of response to that really quickly, then Councillor Zorshaw, there've been lots that I've heard, and we can make some amendments as we go through to some of the individual things. I think what I've heard in terms of that the last action, if this works for the board, is we probably do need 2 discrete actions. We probably do want to talk about carers from an all age perspective, and caring across the life course, and the carer strategy being a plank within that, and then a discrete thing which is about young carers and making sure that young carers are prioritised. We do actually, in the health and the school survey, collect data on caring status. That's obviously filled out anonymously, so it doesn't require the school to know. Out of that, we had 70 primary age children, 108 secondary age children who said that they were a young carer, and we were able to ask them. We did ask them the question around loneliness too, so we can track that, and then we can use, as Sarah said, the ASCOF measures around carers who are older. So I believe we're measurable on these 2 things. So if the board are okay, we'll take away forming those 2 actions. Probably organise a meeting with Sharon Smith from the Carer Centre just to kick that off, and bring back to the board some progress on that. So just wanted to cover off what we'll do as a result of the conversation.
Thank you, Peter. And I did want to make a brief comment as well on the young carers, and there was talk, I think, from Councillor Runciman about it being very, very normalised behaviour, and people, I think it came from young people, don't see this necessarily as they're doing something different. But I also wondered within this caring role, I know there was mention of 6 in high schools, but it was about how these are identified, but also how the young people want to be identified, and whether there was any issues around consent and stuff in that, of them consenting to being identified when it's normalised behaviour and they don't see any difference to that. But yeah, thank you very, very much for the report. The recommendations going forward seem to be really innovative. Martin, did you want to say something really briefly?
Just on the 6, I'm not sure that's very accurate. I think I've probably seen 5 this morning. So I think we probably just need to do something to check that.
It was identified, we were talking about it in the voice and involvement group, the subgroup of the Safeguarding Children's Board, and it came out of a survey of schools which had only identified 6 carers in secondary schools.
So it's possible that carers have been identified by other people, organisations in other ways, and that's some of the people you
The
may.
Carers Centre questioned it on the grounds that they know they've got more than that on their books. So that's how we've got them around the system. But in terms of actual identification within a school setting, that was the figure that came back from the survey.
Alison, did you want to add something?
Yeah, so Sian just said what I was going to say really. So the carers said have told us it's 6, but they work with over 200 young
Okay.
carers. And it is important that they are identified because their school absence is much, much higher.
Yeah,
It's
absolutely.
23 days compared to about 14. So, you know, whether they want to be identified or not, we need to be identifying them to make sure they have the support so that they have the same life chances as every other child.
And especially when you get marked up for not being on time, for not having your homework done,
Yeah.
depending on how the school approaches discipline and noting things, some of those young carers face a much rougher time at school with things that they have no power to change. So I think it's really important we understand that.
Thank you, and thank you, Peter. So we will continue to delegate the responsibility for goal 10 to the officers, and continue with updates from that one. Thank you very much. Okay, so we move on to agenda item number 7, which is my report. I will just go through a couple of areas really briefly, but less than around 10 minutes and before we move on. So the first thing I wanted to highlight was the Healthwatch nomination award for improving healthcare in the city. They were nominated for the National Impact Award, recognising outstanding examples of people sharing experiences to improve care for their community. They were nominated for the independent evaluation report highlighting concerns around the autism and ADHD pathway, which we've had many discussions about, and I would just like to thank everyone at Healthwatch for their ongoing fantastic work, which enables, and I think, all the voices to be heard, which I think is so important, particularly voices that we seldom hear, which is so much more important to include these voices, to include these people in it. Such an important part of advocating for change in healthcare, to listen to all these people. Was there any update on that, Sian?
We have now been commended for our work.
That is amazing. Wonderful. Fantastic. Thank you very much for that. And one of the other things I wanted to mention was the draft adult social care strategy for the next 3 years is now completed. This is setting out our commitments, priorities, challenges and opportunities. Within this, there is a really clear vision for York, recognising the strengths for the individuals and using the strengths in communities, which supports people to live healthier, longer, more independent lives, and reducing inequalities. Really fits into our future vision and the neighbourhood model. And it sets out that it's about everybody feeling valued and meaning they should be at the centre of care, with services closely around them, to make and helping people make their own decisions about their own lives in the ways that they want. This report shows that the really invaluable role that carers provide, and we've had a lot of discussions around carers recently, recognising that they may need support too, because caring can be really hard on the people who are caring, and really recognises that the people around them need support, and it recognises the need for staff to have tools to provide the care and the support. This strategy has the 11 key priorities which focus in all areas of improvement and development, and include, I think it was Making It Real framework, created by a group who were dedicated to improving healthcare in the city, using a strength-based approach and working together while involving people with lived experiences around the whole area of design, which is also another really important part to listening to everybody within these reports. And the final area I just wanted to highlight, but isn't totally completed yet, is the pharmaceutical needs assessment. But the full version will be available in autumn 2025, so this year. And the main purpose of this is to look at the evaluation and applications for new pharmacies in the area. There has been a lot of talk around pharmacies recently, and a lot of residents have said what we've discovered from the very initial findings is that people want provisions at weekends and out of hours after 5 o'clock, and are really concerned that there may be changes to opening times. I think this is particularly prevalent as we're looking at more and more services coming to pharmacies. I'm seeing adverts on my social media the whole time to bring children in if they've got an ear infection, and all those things are going through and through and through. So public health are working with the professionals such as GPs and charities to work around people accessing pharmacy and facing barriers. And in June, there will be public and professionals will be invited to comment on the draft P&A before the final version in the autumn. So were there any questions, Sian?
It wasn't a question, but I just wanted to say congratulations to the public health team, because the last time we did the P&A, we commissioned it from NEX and we got 62 responses. And you have done so much better this time round.
There's over 400 this time.
It's so important to note that that work, we've done it in-house, we've worked really hard on it. And I think public health need to take some well-earned credit for having got so many more responses this time round.
Yes, thank you. Sarah?
Yeah, just a quick point to say that obviously the consultation's open around this strategy and we put to the end of March. I have been made aware by a couple of people who are really interested in the strategy that they might need a little bit longer to be engaged in and feedback on that. So we've said absolutely, if that's what we need, we can absolutely take a bit more time over it if we need to. So I just wanted to mention that in case people might be listening to the meeting today and think they might have missed the boat on that. If they can't get to a conversation before the end of March, we can absolutely take as much time as it needs. I'd rather do it.
Yeah, I think we need as many voices as possible, don't we? And if that's going to take a bit longer to hear more people, I think that's absolutely great that more people are being involved. Did anybody else have any further comments? No. Okay, so we will move on to agenda item 7, the health and wellbeing, the update from reading the wrong line, the update from the York Health and Care Partnership, and Sarah is going to present this report. And we've got around 30 minutes, including discussion and questions. Thank you, Sarah.
Thank you, Chair. I won't talk for 30 minutes. You'll be glad to know. So this is our usual update report from the York Health and Care Partnership. I was just doing the counting, and I think there are 8 members seated around this table who have all been part of York Health and Care Partnership discussions recently. So plenty of people who can have my back as well, should I go off. And I should say this is my last report, so I will be going off to have a baby soon, but it won't be the last report from the York Health and Care Partnership, and it's also the last meeting that is taking place in shadow form, and from the 1st of April it will take place as a joint committee of the ICB and the council, subject to all the final approvals, but we are very, very close to being there. So I'm pleased to kind of have got it to that point, I think, before I take my short break and then return to see how well you've all delivered the plans in the next few months. So in terms of the report, I'll just pull out some of the sort of key highlights. So starting with the meeting that took place in January earlier this year, the York Mental Health Partnership, you'll remember, moved under the York Health and Care Partnership Executive Committee last year, and we received a report around the progress that the Mental Health Partnership has been taking in terms of the work going on with the Mental Health Hub at Clarence Street, which opened in April, and the hive of activity going on now around supporting the 24/7 neighbourhood mental health centre due to open in Acomb, I think this summer. I'll say summer because I think I said a specific date last time, which Brian from Chew gave me a few words. Do we know, David? Summerish is fine. Good, excellent. And we received the report, and I think the executive committee discussion was very much focused on the future. So recognising that we've been incredibly lucky to secure dedicated funding, particularly around the 24/7 mental health hub, but also transformation funding for the existing hub in Clarence Street. And our attention now is about how do we as a leadership support a future model that builds on the legacy and the learning. We know we can't rely on extra money, and actually that's very, very challenging for the staff, for the voluntary sector, for the NHS staff and the social care staff who are working in the hubs. Actually, what we need to start to do is to think about how do we take the learning, how do we maximise the long-term benefits. And some of that is about the way that we are commissioning core services and how do we commission services differently in the future, but also about how do we support our practitioners to overcome some of the differences in medical and social models around mental health. You know, there are the two worlds colliding, and how do we support practitioners to work differently moving forward. So the executive committee is very supportive of both the mental health partnership supporting that work, but also the joint delivery group, which is mentioned here, which is a triumvirate partnership between the providers involved in the hubs. So how do we support that co-design of a future permanent model, building from those frontline teams who are working in the hubs now, so it just becomes the way we do business. We also commended the all-age approach being taken with the development of the Children and Young People's Mental Health Group, which Peter made reference to earlier. Lots of opportunities, I think, that to connect it to some of the work that we've been talking about through this board today. So Jamie Lee and Grace might want to be invited in to also contribute in terms of some of the work that it will be taking place through that group. The second item that we talked about in January, and again, we've heard quite a lot about it in the course of this meeting, but that is the decision in terms of supporting how we will approach health inequalities and prevention with a dedicated fund, as we've said. I think it's quite a sizable fund. I think it's I want to say just short of about £750,000, £1 million over 3 years. Yep. 4 years, thank you, Peter. And we've got the approval then to take that forward. And we've got much more strategic approach than we've taken in the past few years around 3 pillars. And we talked about one earlier around community-based interventions focused on children and young people. And that is going to support funding in the voluntary sector as well, in terms of, we know we get huge value from working with the sector, but actually focusing that around children and young people as well. And pillar 2, all around improving diagnosis and outcomes around secondary prevention. And that is going to be supporting additional funding to general practice in terms of that targeted focus, addressing health inequalities, and very, very measurable as well in terms of being able to see some of those immediate impacts. And then pillar 3 is all around prevention, with a set of actions to strengthen and simplify existing services. And this is an area where I think as we start to develop our neighbourhood model, we can start to see how each of our neighbourhoods are identifying those populations in the neighbourhoods around rising risks, perhaps rising service use, high service use, where actually a multi-agency response is needed to provide that earlier help and reduce the burden on statutory services. So quite a strategic approach from what we've taken in the past. And the executive committee did make the point that we must ensure that we're not just thinking about health inequalities and prevention in terms of small pots of funding. You know, £750,000 sounds like quite a large amount in the one hand, but actually we're spending hundreds of millions as a city. So actually, how are we thinking differently about gearing up our wider core services to really support that shift from treatment to prevention? And then the third area of business in the January meeting was around what work we can do to collectively shape our health and care services in the city over the next decade or more. We've been talking to our frontline service staff and GP leaders over the past few months, and this was also in the context of the Integrated Care Board's Design for the Future Blueprint, which came to this board in November. And we received a report which was the culmination really of that work. It is a long-term, quite ambitious programme of work to really support the kind of fundamental reforms that we want to see in terms of the way that health and care is provided. There are a number of factors why we're doing this now. One is there are a series of sort of push factors that are pushing us towards different working differently. They are that the continued exponential rise in demand, rise in morbidity across all age groups, the population growth that we're seeing. You know, York is a great city to live. People love to come and live and work here, but that does create strain on our services. And also we have some real issues with some of our buildings and the poor state of some of our buildings and the ability to grow to meet some of that additional demand. There are no quick fixes. We need some significant change to the way that we plan together. So yes, there are lots of push factors, but there are also lots of pull factors as well in terms of working differently, in terms of how we could fundamentally kind of redesign and reshape services under this Accelerating Healthy Communities banner. And that is very much about the fact that health and care practitioners are keen now to move towards a much more of a neighbourhood model, because people are becoming more complex and therefore services must respond in terms of a multi-agency. And we are still finding, you know, the default is working in sectors and silos. So practitioners very much wanting to work differently, but held back by the physical infrastructure that we have in the city, which is partly about buildings, but also around digital connectivity as well. And we need to start to tackle some of those really big challenges if we are to move forward. Again, this isn't in-year work, this is 10, 15 years, but if we don't set out an ambition, then we're never going to get there. So it is early days, lots of thinking to be done around this, and we as an executive committee signed off some dedicated capacity and essentially a bit of feasibility testing over the course of the year to really understand what we think we can do, accepting that it is ambitious, it's going to need some difference in thinking in terms of funding and investment, but we've got to start somewhere. I think it's just worth noting as well that just around this time in over the course of January and February, both NHS England and the Department of Health and Social Care issued the same communication around the importance of neighbourhood models. That went to the NHS, but also local authority chief executives, which just highlights the importance of health and social care getting behind that neighbourhood plan as essentially a redesign of public sector health services. So I'm sure we'll talk about that more as a board over the next few months. Moving on to the February meeting, again, talked about the formulation of the joint committee, and we've had a number of development sessions, one in December, one in February, and this one focused very much about not so much the commissioner part of it, because the joint committee is about a joint committee between the ICB and the council, but actually about the wider commitment from the partners, our providers, and the education sector, Healthwatch as well, and how do we kind of work together. Another step forward really in local autonomy, transparency, joint accountability, so moving further towards that with the development of a partnership agreement. Also just to note that last week the ICB approved the establishment of that joint committee, and at the March meeting of the Place Board we also approved the committee's priorities for the next 3 years. So essentially the joint committee will start in April with a very clear remit, understanding what it's there to do, and we'll have the tools, that it'll have the legal mechanisms, the partnership mechanisms to crack on and deliver. It might just be a good opportunity as well just to mention that members of the board might be aware of last week's announcement. So there was an announcement on Thursday. In fact, I think it was at the same time as our Place Board, so it was all happening in the meeting. But there's probably 2 key messages that came out from the government. One was around the abolition, is that the right word, of NHS England. and which was, you know, really big news. It's fitting that, you know, obviously the government established it and the government can disestablish it just as quickly. But that was really big news and a kind of signalling of, you know, greater direct control from government around some of the big kind of performance targets, and particularly around NHS trusts. But also within that was a headline ask for ICBs to reduce running costs, which is essentially the costs of running the organisation, so the staff, essentially staffing costs, and to do that by Q3, which is essentially December this year. So incredibly short timescales, and I think probably that we'll see short timescales for NHS England as well. So I just wanted to give a bit of a message in terms of, I think the first thing to say is we probably have more speculation about what that means than fact at the moment. As soon as the ICB knows more, we will share more with partners. And my message to Health and Wellbeing Board is that we absolutely will double down on place. This does not change the focus at all. And actually, places are far more than ICBs and NHS, you know, and there will always be an NHS commissioning function, and that will continue. And actually, as we've said before, this ICB is very committed to place, and that does not change. So we double down, we continue in the work that we're doing. As I said, we've done a lot of work over the last few months in terms of establishing and strengthening our governance. And we know exactly what we need to do, I think, over the next 2 to 3 years in terms of those priorities. So that's my key message on that, I think. And then finally, just to pick up on the work of the York Population Health Hub, we have a number of assets in our place that others do not, and the Population Health Hub is one of them. The Accelerating Healthy Communities work that I talked about earlier, the Population Health Hub have been actively involved in starting to support the development of the neighbourhood model, which is absolutely part and parcel of that, and integrated neighbourhood teams, which is that multi-agency teams coming together around locally defined populations. So that's work that we asked the Population Health Hub to do in January, and they've almost completed that. What that will give us is, for each of our neighbourhoods, a population health insight pack, and then we can use that to start to move beyond and connect staff with that data and insight to be able to design the local interventions to tackle some of the rising need and rising risks, as we've talked about through this board. They've also been contributing to the pharmaceutical needs assessment as well. So continuing to do some really good work. And just finally to mention the Humber and North Yorkshire Integrated Care Board annual report, and just provided some draft wording for you to see there and comment on should you wish. I think there is a bit of time to tweak this if we need to. We had a 200 word count limit, I do believe, so just to give you an idea that it is short and sweet because that's what we were asked to provide. But also, and more importantly, I would say this, work has started on our local York Health and Care Partnership annual report, which you might remember last year came to the Health and Wellbeing Board, I think last July, and that is much more extensive, you'll be pleased to know, in terms of really setting out the work of the board, the achievements that we've made, and then the priorities for the next few years. So that will be coming, I think, in draft for discussion to the Place Joint Committee in May, and should be coming through here for sign-off in July. So they were the sort of highlights, I think, of the last couple of months, and really happy for partnership colleagues to contribute, or colleagues to ask questions. Thank you.
Thank you, Sarah. Peter, did you want to?
Thanks, Chair. Thanks, Sarah. Yeah, do apologise. I have to leave at this point 10 minutes early at the end of the meeting, so I wanted to get a comment in quickly, which just to thank Sarah for the report, and I guess to just make that sort of comment just on the news, and you know, I think I'm right in, Sarah, you have around sort of 10-11 members of staff in the York Place team in the ICB, as a council, as a partner within public health, we really value the work that your team carry out. I know nearly all of the individuals and think they do excellent work. So just wanted to almost have that on record that, so it must be a very unsettling and difficult time given the news. Anything we can do to support that team as it goes forward. But, we really look forward to continuing to work with you all because some of the relationships outlined in your report and some of the ongoing work is really valuable, I think, for the residents of York. So thank you.
Thank you. Would anybody else like to make comment on Sarah's report? No? Okay, well, thank you very much for the report. I would like to echo Peter's comments about being really supportive and appreciating the joint work, and it must be a really unsettling time. And also to say thank you to you, because this is your last meeting for a while, as you've said, and you will be back. But thank you for all your hard work that's gone into all the reports. Thanks a lot. And that is the end of everyone's done. Thank you.